Hello everyone, I'm Tiffany Dudley. I'm a general dentist here at Spodak, and I'm here today with one of our patients, Ryan. So, Ryan, first, what was the driving factor to you wanting to get a sleep appliance?
Well, her name is Nikki.
So your partner,
Yeah,
partner
so my
said,
girlfriend-
like, hey, here, I don't want to sleep in this room with you anymore if you're snoring. Is that kind of
Yeah,
how it went down?
Yeah, one of the things. She said that I stopped breathing at night. I was snoring a lot, very loud. I kept her up, and effectively there was a solution.
Yeah.
And I was like, whoa. I've done this before. They put me in a room. They patched me up with all these devices, and I said, I'm not doing that. She then informed me that Tiffany Dudley over here was able to help me out.
So what Ryan's talking about is, most people, the old way of diagnosing, or the gold standard for diagnosing sleep apnea, is an in-lab sleep test. Now, most of the sleep tests these days are done through the use of technology with a home sleep test. So instead of going to a sleep lab where you're hooked up to a bunch of machines, you feel like a science project, you don't know if you're sleeping, or most of the people say, I didn't sleep at all during that sleep study. I don't know how they got any information on me. You do it in your own bed. I've done one. I took one home because, if you're going to have people tell people to do it, it's beneficial to do it yourself and figure out what it feels like. I did a sleep study. Fortunately, I didn't have sleep apnea, which was wonderful. Okay, but it is a process to do this. I mean, you have to take it home. You have to use it the way we tell you. It turns on and off by itself. But there's a couple things you put on. You take the home sleep study home, whether it is drop shipped to you or you take it from your doctor's office. It's something that goes on your nose, your finger, and then a belt around your waist.
Yep.
And it's pretty simple to use. You drop it off or ship it back to the sleep testing company, and then in about a week we have your results.
Or for me, I showed up to Spodak. She gave me this little box, and she put it on. And the next day I dropped it off in the morning. So it took all of 5 hours of sleeping at night and
right.
A couple minute drive.
Yeah. So fast forward, we got your results. We realized that you had sleep apnea. We talked about your treatments, and you chose the oral appliance.
Correct.
How did you feel it went with the oral appliance? Like, what were the positives of the oral appliance?
So I did Invisalign, and I'm used to wearing a retainer, so not a big deal. The oral appliance, for what you guys don't know, is just the retainer, a different retainer that you put in that basically pushes your jaw out, which opens up my airway. That's effectively a simple non-medical explanation.
Yeah, and that's right. I mean, the simplest thing is when you have sleep apnea, if we think of your airway like a balloon, the balloon is essentially closed. So if you blow up a balloon and you pinch it off, none of the air comes out, and that's what's happening when you're sleeping during apnea. No air is going in or out, right? So if we can change the position of your lower jaw, which moves some of the structures forward, mainly your tongue, right, to not fall on your soft palate, then the airway is allowed to be opened and you're allowed to breathe during the night, which also stops snoring, because snoring is just the annoying vibration of those tissues when they get so close together.
Right.
But yeah, after we gave you the sleep app, we had you download the app to check if you were snoring at night. Easy to download.
Yeah, super easy. Didn't cost me anything. You just put it next to your bed, say to turn on in a half hour, or whatever, kind of like a sleep timer for your TV. And then it monitors you, and it gives you a score the next day. And if you drink, or if you smoke, or you had a big meal, or you stayed up late, or worked out late at night, there's a little button you can click that should offset, how it gets that data. But super easy. Glad it didn't cost anything, and it was cool because when I started, it was like 35 rating, and basically I think below a 5 is no sleep apnea, right? So I was super high, and then as I started wearing the device, it started getting down to 10, 12. 6, sometimes a 2 even, and then it was awesome. I was sleeping better. I woke up refreshed. Didn't need to take the midday naps. Instead of sleeping 9 hours a day, I only need 6, because in that 6 hours I'm actually sleeping, versus I used to have 9 or 10 hours to get my 6 hours.